currently how we monitor patients on the general care floor is in snapshots of time, meaning a nurse or a provider will go into a patient's room every 4 to 6 hours and do a set of vital signs and check in on a patient. That, based on what myself and other investigators have uncovered, is very inadequate. And the reason I say that is because we have shown in our prior investigations that low oxygen saturation or hypoxemia, hypotension or low blood pressure, and even hypoventilation is common and profound and persistent and goes unnoticed for long periods of time when this sort of snapshots of monitoring policy is implemented by hospital systems. And that, for me, is the biggest gap that exists right now. If we are able to implement continuous monitoring, we are going to be able to see these changes in vital signs. We're going to be able to correct for these changes in vital signs. We're going to be proactive in our interventions before patient harm actually happens. And that's more so because we know that patient harm or these overhead code blue calls that you and I hear when we get into hospitals don't just happen all of a sudden. This is a gradual change in vital signs that occurs over 4 to 6 to 8 hours. And if we had continuous monitoring, we could see this pattern change evolve in front of our eyes and go in and correct it, intervene early, and possibly and likely save several lives.